So today we are going to go over wound dressing change using sterile technique. But before we get into the actual dressing change, there will be two videos. This first video will be on how to remove the dressing and assess the wound prior to doing your sterile wound dressing change. So before we get ready to remove the patient's dressing, of course, just like with all your other skills, you want to verify the order, that there is an order for wound dressing change. That order should have any orders as pertaining to if that wound will need cleaning, what supplies you will need for cleaning and dressing the wound. Next, of course, after identifying your patient using two identifiers, name and date of birth, we will explain to the patient that we will be changing their dressing. You also want to verify any allergies. So you want to be specific, like with our other skills. So with the wound dressing change, if there's an order to clean the wound and you will be using betadine, you want to check for any allergies for betadine or iodine or shellfish. You also want to ask about allergies, of course, for tape or any type of adhesive, as well as latex because of your gloves. Now, once all that is done, you also want to ask about their pain scale. You want to assess the patient's pain. When patients have wounds and there are orders for wound dressing changes, especially if the wound is very extensive, like in our model here, the doctor will have orders to administer medication, pain medication, prior to starting your wound dressing change. So if there's an order for medication, pain medication, you want to go ahead and verify when the last time the patient had it, and denote that you need to know that it needs to be administered within 30 to 45 minutes, especially if it's an oral med, prior to you starting the dressing change, to give that medication time to work and provide comfort to the patient during the dressing change. Okay, so now we're going to go ahead and begin. I've already done hand hygiene and I have on clean gloves for this part. This is not a sterile procedure, so we do not need sterile gloves. So one thing that we want you to do when you are removing any type of dressing is you want to pull the skin taut and away from the actual tape or dressing. Okay, you want to pull the skin taut and away as such, gently lifting that tape. And the reason for this is that you want to prevent as much irritation or damage to the skin where that tape has been applied. Okay, especially if that tape is placed pretty recently, it usually sticks very well. Okay, so you just want to make sure that you're using that technique. Now, once I have the tape removed, okay, so once that tape is removed, I can go ahead and then remove the actual outer dressing. Okay, so I'm removing that outer dressing, and as I'm removing the outer dressing, I come to the gauze that is used to pack the dressing, and I'm looking at the appearance of the gauze, denoting any drainage, such as serosanguinous drainage meaning really bloody serosanguinous, which is a mix of blood and clear drainage. If it's pinkish in color, if there's no drainage, as our wound here. And I'm also assessing for an odor, if there is a bad smell, because this could mean that there is infection. Now you want to handle the dressings, especially the dressings that you use to that was used to pack the wound. You want to handle those dressings as minimal as possible, because your patient's wound could have MRSA. Okay, so again, you're just handling the edges of those. Now I'm looking at the wound bed itself. So let's go ahead and note that this wound is definitely a stage 4, and this is because there is bone present, there is destruction of fascia, subcutaneous tissue, as well as muscle. So this is definitely a stage 4. Now I'm looking here, and this area here is what we describe as eschar. Eschar, you are not able to stage the wound, and we'll talk more in class about wound staging, but you're not able to stage the wound if eschar is present. Eschar has a black, waxy, leathery type of appearance, and it must be debrided. And once that debridement or removal of that eschar is completed, then the wound bed itself can be assessed and staged at that time. Now, what you see here is what we call slough. And slough is basically similar to like a type of slime or anything like that. It is a mixture of pus, white blood cells, dead skin, and it occurs during the wound healing process. Now, you do want to remove any slough from the wound bed to aid in healing, but you want to remember to remove it with care, because as you see here, this slough is over this deep red wound bed, and this is actually a good sign of wound healing. We describe this in our documentation as beefy red, and it just denotes that there is good blood supply to that wound bed. But what you cannot see in this particular wound that you may see in an actual wound is what we call granulation tissue. And granulation tissue denotes wound healing, and that's a good thing. And if you were to take like sugar and sprinkle it over the wound bed, it will have this raised, bumpy appearance. But that is granulation tissue. And if there is slough present, you want to gently remove that slough, taking care with either sterile water or sterile saline, and not disturbing that granulation tissue. This is why you may not have an order all the time from the provider to clean the wound bed, as the wound team or wound care providers may not want any disturbance or removal of that granulation tissue, because you're going to delay wound healing. Okay, so let's move along. Now that we have taken a look at our wound, we want to measure our wound. So I have here a sterile Q-tip and marker and ruler. Now, this is not a sterile technique. We're not using sterile technique at this point, but of course you want any supplies that you put in the wound to be as clean as possible. So that is why, and these come sterile in case they're opened up onto the sterile field, okay? So we want to first measure. We measure our wounds so that we can keep track of healing. If the wound is getting larger in size or deeper in depth, then that tells the wound care team that the wound is getting worse. It is not healing properly. If the depth and the width and length are getting smaller or shrinking, that lets the wound care team know that the wound is healing. So you measure the deepest part of the wound first, and doing so, there's techniques, different techniques you will see on measuring wounds, and this is just one. So I'm using the sterile Q-tip. I'm in the deepest part of the wound, and I'm sliding my fingers down to the edge of where they would meet the skin surface, okay? And then I would just take my ruler, and it doesn't matter if you do it in inches or centimeters, just denote which one you're using. And this is how I will measure it. So I'm going to say the deepest part of my wound is about 2 inches. Then next, I'm going to go ahead and measure any tunneling. So this that you see here is what we call tunneling, and it sounds just like its name. And basically what it means is that this wound has actually created a new area, and due to drainage and warmth and bacteria, is causing further destruction of the wound bed in a different location. And then this here area here is what we call undermining. And basically, undermining, just think of a ledge or like a shelf type appearance. And basically, you have your top layer of skin here, but there's no subcutaneous fascia or muscle attached. Okay, so this is what we call undermining. Now, we have to document where we see undermining and tunneling. And to do that, we use the face of the clock. And so, with every wound, when you are documenting your measurements or so forth, you use the face of the clock. So 12 o'clock will be where the head is located, the head of the patient. 6 o'clock would be the feet of your patient, okay? And so I would document that I have undermining, I'm measuring it, sliding my fingers down to the edge of the wound. I have undermining at 12 o'clock, and I would say it's about 1.5 centimeters, okay? Then I would document I have tunneling at 8 o'clock, and that it is also about 2 inches deep, okay? So that is how you document using the face of the clock, so the next provider or care team personnel can follow your documentation and know where to look in these concerning areas. So once I have measured the depth of my wound, then I can measure the width and the length of the wound, okay? And you would do so just like this, okay? Now, again, it is important to measure your wound so that you can help the wound care team keep track of proper healing. So now that I've done my wound assessment, I've measured my wound, I've noted any areas of tunneling or undermining, and I have removed any slough, then I will proceed to do the actual sterile dress and change. Now, for checkoff purposes for this, you will not be required to do any wound cleaning, but we may ask you questions concerning the assessment of your wound, okay? All right, so I would go ahead to remove my dirty gloves, do hand hygiene, put on a clean pair of gloves, and clean up my area to prepare for my actual sterile dressing change.